My name is Kara Goldman. I'm Assistant Professor of Obstetrics and Gynecology in the Division of Reproductive Endocrinology and Infertility at Northwestern Medicine and the Medical Director of Fertility Preservation. My particular area of interest is in identifying a pharmacologic agent that we could use as an adjunct during chemotherapy to potentially preserve not only fertility but also ovarian function. Because the impact of chemotherapy treatments goes much farther than fertility. When a woman loses her ovarian function, she loses all of the benefits of a premenopausal ovary, which include bone health, sexual health, mental well-being, cardiovascular health. And so in order to care for the whole patient and think about cancer survivorship, we think about not only fertility, but all of the benefits of ovarian function. There are thousands of women every year who are diagnosed with various types of cancers during their reproductive years. And unfortunately, we know that many of the chemotherapy agents that are used to treat these young women are also particularly toxic to the ovaries. So at Northwestern Medicine, we have the full range of options for fertility preservation to offer our patients. We routinely offer egg and embryo freezing. Embryo freezing has been performed for decades, and we understand that that is a highly proven method. Ovarian tissue freezing is an approach that has evolved very rapidly in our field. So this involves removing one ovary or a portion of an ovary, freezing a portion of that ovary that contains all of those premature egg cells, and then those tissue fragments later on get reimplanted in that patient when she is recovered and able to consider a pregnancy. And so this has two benefits. The first is that the patient regains some hormonal function, which is really critical because of the estrogen that ovary is producing and the importance that has for bone health and sexual health and cardiovascular health. And then the second benefit is that implanted ovarian tissue can then be stimulated in an IVF cycle so that those egg cells can grow to be retrieved and embryos can be created in an IVF laboratory, and that embryo can then be implanted in that patient for a future pregnancy. So ovarian tissue cryopreservation has really tremendous hope to provide patients both hormonal function as well as fertility. So we understand the importance of caring for the patient clinically, as well as understanding the larger picture in moving forward research in the field, and in an even broader sense, thinking about legislative aspects that affect our patients and increasing access to care for our patients.